Welcome to AQuity Solutions presentation for the Nashville Healthcare Council. My name is Jamie Christian, and as the Director of Enterprise Operations for AQuity's Virtual Scribing Services, I'll serve as today's moderator. Joining us is Lori Stonecipher, Vice President of Clinical Informatics at Community Health Network in Indianapolis, Indiana. She's led their clinical informatics team for the past 5 years. Prior to that, she was the Epic Ambulatory Director, where she co-led the Epic implementation for over 250 ambulatory sites. Lori has been in the healthcare industry for 20 years after earning her bachelor's degree in computer information systems from Indiana University and a master's degree in business administration from Indiana Wesleyan. We're also joined by Mark Gum, General Manager for AQuity Solutions Virtual Scribing business. Mark has over 20 years in healthcare IT and services, working at the forefront of change. In driving our scribing business, he is focused on improving physician wellness as well as helping our clients achieve better clinical and financial results. Today, we're going to discuss physician burnout and how virtual medical scribes have proven themselves to be an effective remedy. Let's look at the cost of physician burnout. In an AMA study conducted by one of our partners, the University of Wisconsin Health, prior to our scribes being deployed, they found physicians on average worked 11.4 hours a day, with more than half of that time directly engaged with the EHR. Physician suicide rates have risen to twice the national average. Burnout contributes to about $4 billion annually in lost productivity. Burnout symptoms reported by 44% of physicians nationwide, and the cost of turnover to replace burned out physicians can cost an institution between $800,000 and $1.3 million per the AMA. To truly understand why these numbers are so significant, let's take a look at the causes of physician burnout. The AMA released a study that identified the top 10 causes earlier this year. After surveying 15,000 physicians representing about 29 specialties, the top 4 causes all have to do with being distracted by the EHR when they should be paying attention to their patients. So too many bureaucratic tasks, charting, paperwork, order entry. Providers spend so much of their time doing what we call desktop medicine and not focused on the patient, interacting with the patient, and verifying that the patient really understands their plan of care. All of these top 4 causes can be effectively managed with virtual scribes. Mark, as the General Manager for AQuity's Virtual Scribe Services, are there any other studies that you've seen that show the correlation between burnout and scribes?
You're right, Jamie. There are a lot of AMA studies, along with many others from JAMA, Family or Annals of Family Medicine, Harvard Health, and others that target and substantiate the impact of scribing on improving physician wellness. We've recently published an article in AHIMA entitled "Physician Burnout to Business Traction," and it highlights not only how scribing programs can impact physician wellness, but also how it can drive better clinical and financial results.
Fortunately, we're joined today by someone who can speak directly to these issues. I've worked with her closely on this project since 2019. She's the VP of Clinical Informatics at Community Health Network, here to tell us more about virtual scribing at CHN and what they've learned. Please welcome Lori Stonecipher.
Thanks for the introduction, Jamie. It's been a pleasure working with you for these past few years. As you know, Community Health Network embarked on this journey with AQuity for one reason that you already talked about: provider well-being. We offer the virtual scribes to all of our ambulatory providers at Community Health Network, and we look for ideal candidates. Those include providers who are unable to complete their notes during the day and who are spending a lot of time after hours documenting in the EHR. We also feel that mindset is key. We want offices where they are already working at the top of their profession and standardized workflows, as well as providers who are willing to invest in the time to train their scribes. So our program by the end of this year expects to have 200 virtual scribes with AQuity.
Laura, I think it's very important that you highlighted the fact that, finding the ideal candidate for the service and the process that you guys use at CHN to really identify those providers. It's not unique to providers that aren't tech savvy, and it's not unique to providers that are super tech savvy. It's unique to providers that are willing to put in the effort to make themselves more efficient and kind of adhere to the process.
That's right, Jamie. We're not necessarily looking for tech-savvy providers. We are specifically looking for those who are showing signs of burnout. So those who are spending all of that extra time after hours documenting in the EHR, we want to give them a lifeline. And we feel that that lifeline is providing them a virtual scribe to help with the documentation.
I'm also excited to see CHN get to 200 providers live. I remember when we partnered up in 2019, we were in the mid-30s, and to see the growth that we've taken from June to 2019 to now has just been tremendous. All the specialties we've added, and I really feel like we've made a huge impact to our CHN providers with the virtual scribing services.
Yeah, absolutely, Jamie. It's really impressive to see what our collaborative teams have done over the past couple years. And like you said, growing from 30 providers in our program to near 200, pretty impressive, especially this year in 2020 while we were dealing with the whole COVID pandemic as well. It was really cool to watch our teams be able to continue to implement and help those providers, even as they were shifting how they delivered care to our patients.
That's great, Lori. What you've done at CHN is a great example of how we try to work with our clients. And I'd love for you to share a little bit about what your results were from your scribing program.
Yes, I'd be happy to share. Here are some of the results from our class survey, where we surveyed our providers specifically around their well-being and their EHR satisfaction. So if you look at this graph here, on the left, you'll see the measurements that we were specifically looking at. The first score, or the first column, is the measurement after they were given a scribe. The middle column is their previous score, so before they had a scribe. And then the final column on the right shows that difference and the change in those metrics. So as you can see, for our providers who had scribes, their net EHR experience improved by 16 points. You'll also see that our providers that have scribes find fulfillment in medicine 100% of the time. And most importantly, you'll see the burnout score improve by over 16 percentage points. So those providers with those virtual scribes say they are 91% not at a burnout level. One of the other impressive metrics on this is the number of hours that they are not charting at home anymore, improved by 33 percentage points. So when you look at our providers with scribes, they are spending less than 5 hours a week on their charts, and that is so important to us.
Lori, that is fantastic to hear. Could you share some feedback you received from some of our providers around the scribing service?
Definitely. We've had some great testimonials from our providers that really resonate with us. A couple of those quotes are, "This is the best thing to happen to me in 30 years of medicine." My personal favorite is, "This is life-changing." We've heard that on more than one occasion, as you know, Jamie. We've also heard things such as that it's helped me balance my work and family life, and that I've regained my home life.
I absolutely love hearing those comments. I feel from a scribing operation standpoint, we receive those comments weekly from all of our providers. We actually post an AQuity Top Tuesday 3 quotes every Tuesday on LinkedIn that kind of highlights those comments from our providers. And, I remember one of the most impactful comments that I have heard actually came from a CMIO who had stated that, 20 years of working in IT and healthcare and implementing services to help target and improve physician well-being and burnout, he noticed that the Scribe program was the one that really followed through quickly on that change from physician wellness and improving physician burnout, because it wasn't just adding another technology layer to the service. It was giving that provider their own assistant to help them through the difficult parts of documentation.
To that point, Jamie, we also have providers that report comments and things such as more face-to-face time with their patients. They are able to improve patient satisfaction. As you'll see on the slide, the providers also report less anxiety in the exam room. They're not so much focused on the computer, but truly focusing on their patient. They have more time to talk with their staff and collaborate with their team about coordinating the patient's care. They also report less pajama time and more time at home with their families. All in all, we feel that this is safer for our patients. We're improving documentation, and we are more thorough than we've ever been by having the assistance of our virtual scribes.
That's some really great feedback, Lori. Are there any other things that you measure that speak directly to the relationship between your virtual scribes and physicians?
Yes, we actually measured the scribe satisfaction at Community Health Network. So again, we surveyed our providers to ask specifically about their satisfaction with their virtual scribe. As you can see on the chart, the green bars, the dark green and the medium green are the strongly agree, and those are the things that we're really focused in on. The first two measurements you'll see there are extremely high. Satisfaction of my experience with my remote scribe, and having a scribe improves my focus on patients. So we look at those as two top metrics to see that our providers are indeed satisfied with their scribes.
That's really interesting, Lori. You know, what I hear a lot from providers is that the implementation process for starting a virtual scribe is really, really challenging. And a lot of them are almost discouraged going through the process. I remember I had this one provider after day one, he wanted to throw in the towel. I asked him to stick with it for just one more week. And 4 days later, he emailed me thanking me for encouraging him to stay with the program. And he's one of those providers that will actually say, this has changed my life and how I practice medicine. Do we have any of those that you can speak to at CHN?
Of course we do, Jamie. We definitely have some providers who are ready to give up almost immediately. However, when we talked to them and told them about the investment that they had to make, not only with the scribe, but also with themselves, and asked them to stick to it, we have a few examples that actually did, and they have built such a remarkable relationship with their scribe now that they never want to give them up.
That's great to hear, Lori. I know implementation can be really rough, but really love that providers are invested in, putting the effort into the implementation part to see that success. Often I also hear providers say that they're able to have time back with their families, make it home for dinner, go to their child's soccer game. I'm sure we have a lot of that feedback from providers at CHN. Can you talk to some of that?
Yeah, definitely, Jamie. I have one story where a provider shared with me that every time she got home from work, her daughter would ask how many charts she had to finish tonight. And so to me, that's a huge testimonial that when your child is asking you how many charts you have, tells me you're working too many hours at home. So luckily, we were able to get that provider a scribe and drastically reduce the amount of time that that provider did after hours on documentation. Again, you'll see in the chart here, if you look towards the bottom, we saw high measures for having a scribe reduce my work stress and also provided me more personal time to talk about the example I just referenced.
That story gave me chills, Lori. I like hearing that.
That was my old provider before I moved to the south side of Indianapolis. She told me that her daughter asked her every night how many charts, and it just broke my heart.
Lori, those are great results. As you guys expanded the program and scaled the program out, were there other unexpected results that you saw?
Yes, definitely, Mark. How quickly we saw some of those well-being benefits. In some cases with our providers, we almost saw instantaneous results of their well-being increasing right away after implementing a scribe. We also feel that the service and the technology of the Scribe program fit right in with the provider workflow. And that was really beneficial to us to make sure that we kept our standardized workflows, but that the scribes just added to the pre-existing workflows. Another example of a surprising benefit is we had 15 providers who had in-person scribes, and we changed their model from those in-person scribes to the virtual scribes. And we were a little nervous about that. Nervous how that would be when they're used to having somebody right beside them, and now this person was going to be virtual. And that went really well. And surprisingly, we had great benefits from those providers who transitioned to that model.
Thank you, Lori. When we think about that transition from on-site to virtual, I know with CHN, we actually deliver our service through global resources. And we haven't mentioned that so far. I'd love to get your opinion on how that service has been received by your providers.
Yeah, that's a great question, Mark. I would say that the global scribes have been received well at Community Health Network. I would say by and large, we don't have language barrier issues or slowness in technology. I mean, pretty impressive when you think about the provider on one side of the globe and the scribe on the other, and the fact that they can work seamlessly together in order to provide great service to our patients.
Thank you, Lori. And I know that CHN made the decision to deploy their entire Scribe program through AQuity Global Resources. And as you know, we do offer both. And we have a number of customers that do choose, similar to you, to use global services. Also, we have folks that use domestic or a combination of the two.
That's a great point, Mark. Labor considerations are really one of the unique factors of a virtual scribe service. So when you think of on-site staffing, you're pretty limited to the zip code of the clinic or the area you're recruiting from. With a virtual scribe staff, we recruit the top talent across the country as well as globally. Scribe turnover, historically in the industry standard, you'll have a domestic resource maybe stay on for about 9 months and then have to turn around and replace that scribe, often because we're focused on hiring medical students or PA students or students looking for professional careers. At AQuity and a lot of virtual scribe services, we looked for career-focused students. So not just your pre-med, pre-PA students, but also other ancillary healthcare staff members like medical transcriptionists and medical assistants that are looking for long-time career growth. Our AQuity average, Mark, I believe, is about 18 months with a domestic resource, which is really double the industry standard.
Now when we talk about virtual services, we also think about how the patient consumes virtual services through telehealth. And certainly many health systems transition to that model very, very quickly. Jamie, I know that you have quite a bit of experience working with some of our largest customers on this topic. Would love to get your view on how we were able to help impact that, and more importantly, how the health system was able to deliver that effectively for their patients.
When mid-March hit, there was a flurry of activity from all of my clients trying to figure out how we're going to, continue seeing patients and transition to this model. Our partners, we work very closely with their EHR departments and their Epic trainers and alike to really create a workflow that supported the provider working from home, the scribe working from home, and the patient connecting from home. So a unique virtual experience for all. I remember when the first 2 days of COVID transition hit Connecticut, one of our partners, Yale New Haven Health, we transitioned 150 of their providers to this work from home workflow within 2 days. And all of these providers had never once worked from home via telehealth. And we worked very closely with their Epic team to kind of outline that process. And I was able to share that with other Epic clients of mine that were still trying to figure out what to do, what's the best method, and collect feedback. And it was a very collaborative time, those last 2 weeks of March, trying to really support the provider in this change, support the patient in this change, and then really be there as the documentation changes also occurred. Lori, do you have any experience from CHN that you'd like to share?
Yes, Jamie, similar to the experience that you described at Yale during the COVID pandemic, we quickly transitioned our providers as well to work from home models. And therefore, it was a virtual experience like you described. It was virtual for the provider. The scribes, the global scribes also quickly moved to a work from home model, as well as the patients connecting virtually from their homes. We've seen a lot of success with the model, and some of our providers that I would say were maybe more hesitant to use the Scribe and that work from home model at first because they weren't exactly sure how that was going to work, quickly caught on to their colleagues doing it and being very successful. So we saw almost 100% of our providers transition to use their scribes during telehealth, as well as if they were in the actual clinic.
I did want to share some other big headline results as well. Virtual scribes can effectively mitigate the symptoms of physician burnout. They can significantly decrease provider productivity and job satisfaction. Results in 79% of providers open to increasing their patient volumes, and so adding patients. And then cause 57% of patients to report better encounter satisfaction and physician face-to-face time, which is particularly important when preparing for the CARES Act that's rolling out next year.
Yes, Jamie. There's also a recent study by JAMA during an EMR implementation, and they studied providers that had a virtual scribe and providers that did not have a scribe. And what they found was that those providers that leveraged the Scribe saw a significant increase in RVUs, about a little over 3,000. They were able to add significant revenue, about 1.4 million, and all for a cost of the scribing program of about $99,000.
You know, the statistic I find most interesting is the $99,000 cost of the service, and how just implementing a Scribe program is less than the cost of adding a mid-level provider to the team. I hope you all can appreciate this discussion and how it really overviews how virtual scribes can truly impact and potentially mitigate physician burnout. So with that, I'd love to thank Mark for all of his insight about virtual scribing, and to Lori for sharing the incredible CHN virtual scribe story.
Thank you, Jamie, and thank you, Lori, for joining us. We appreciate your time, and we look forward to your questions.
I really appreciate the opportunity to tell the story at Community Health Network.
We'd love to hear any questions that the audience might have, so let's open things up for questions.